In this section now, we will talk about the different types of dysphonia. And the different types which can be is adductor dysphonia, abductor dysphonia, and then we have mixed dysphonia. So dysphonia can be of three types: adductor dysphonia, abductor dysphonia, and both mixed type of dysphonia. And the adductor, these dysphonias are due to the abnormalities in the muscles which cause abduction, adduction, and then if both are involved, then both a mixed type of dysphonia is present. Adduction is the coming in the midline, so approximation. When the chords are approximated, it's the adduction function. When they are move away from the midline, that's the abductor function. And when both the are involved, adductor and abductor, then it's a mixed, or you can say the complete absence of the voice. So adductor dysphonia. In adductor dysphonia, adductor muscles of the larynx are involved. Adduction is coming in the midline. So adductor dysphonia is due to involvement of adductor muscles of the larynx. They go into spasm, or the vocal cord go into adduction. So adductor muscles, adductor dysphonia is due to when the adductor muscles of the larynx are affected, as a result of the spasm, and then the vocal cords go into adduction. Here you can see the vocal cords go into complete adduction, and they are in the approximation. Voice is strained or strangled as a result of the adductor dysphonia or abnormality of the adductor muscles. The voice become very strained or strangled. Phonation is interrupted and there is voice break. Sound is interrupted because sound is not properly produced as a result of weakness of adductor muscles of the larynx, and the voice that is produced is strained or strangled, and it's not produced regularly, it is produced in the breaks. Larynx is normal morphologically, and the severity differs from mild to moderate or severe dysphonia depending on how bad is the involvement of the adductor muscles that cause adduction of the vocal cord. If they are badly affected, it can cause severe dysphonia. If they are mildly affected, can cause mild and same moderate and severe dysphonia. Next, flexible fiber optic laryngoscopy. What are the findings will be as a result of adductor dysphonia on flexible laryngoscopy? Patient may have tremors of larynx or palate and the pharynx. So tremors may be present because of the weakness of the muscle. Useful during study of patient's speech, sustained phonation, and respiratory activity. So flexible fiber optic laryngoscopy is useful in all these different conditions, and we can say that with the laryngoscopy that there are tremors in the larynx or palate and the pharynx. Causes are usually the uncertain causes. Then we have exclude the neurological conditions, which include like Parkinsonism, myoclonus. So the exact causes of adductor dysphonia are unknown, but some conditions, some neurological conditions can also cause dysphonia, and these should be excluded, like Parkinsonism, myoclonus, pseudobulbar palsy, multiple sclerosis, cerebellar disorders, tardive dyskinesia, and ALS or amyotrophic lateral sclerosis. CT scan and MRI are help ruling out neurological conditions. Treatment is botulinum toxin injection in thyroarytenoid muscle on one or both sides to relieve the spasm. So, botulinum toxin injections are used to relieve the muscle spasm that can cause the adductor dysphonia. Percutaneous electromyography. This is done to find out the electrical muscle activity as a result of electrical stimulation. Guided route and through cricothyroid space. So these are some tests or treatments that can be used. One, we have botulinum toxin, and the function of this botulinum injection is to relieve the spasm of the muscle. That is effective in relieving the adductor dysphonia, and electromyography through cricothyroid space that give us the function of the thyroarytenoid muscles. Botulinum toxin dose depend on the severity of the condition. If it's severe, then we should use the smaller doses, and if it's more, then we should, if it's severe, we should use more dosage, and if it's mild, we should use the smaller doses. Next, the dose of the toxin is not regulated, cause breathiness of voice, discomfort to swallow. So the some complication of the toxin, botulinum toxin, it can cause breathiness of the voice, the breathing is affected, and discomfort to swallow. Toxin injections relieve the voice break that occur as a result of adductor dysphonia, improves the airflow, benefit lasts for up to 16 weeks. Repeated injections are required after 16 weeks, so it's not like a permanent treatment. Once again, if the muscles are affected, then we need to inject the botulinum toxin. Voice therapy is useful. Without injection, it does not help much. So voice therapy is effective, but it needs to be done along with the toxin therapy. Without that, it is not very helpful. Earlier disease, psychological in origin or psychotherapy is not useful. So again, the treatment is therapy, but it needs to be treated along with the toxin. Again, we can do the section of recurrent laryngeal nerve can be tried as the treatment option, and to paralyze the cords, to interfere with the glottic closure, leading to breathy and weak voice, swallowing discomfort, and treatment used when injection fails and spasms are severe. So botulinum toxin is the first treatment along with the voice therapy. But if that treatment is not effective or it fails, then we should go for the section of recurrent laryngeal nerve that helps to improve the condition in patients who fail to respond to botulinum injection. Next, abductor dysphonia. Abductor dysphonia is due to spasm of posterior cricoarytenoid muscle, which is the only abductor muscle and thus keeping the glottis open. So it's the abductor muscle abduction due to spasm of the posterior cricoarytenoid muscle. So that's the only abductor muscle and it keeps the glottis open. Progressive condition, symptoms are aggravated during periods of stress when patient uses telephone. So patient who use the telephone, usually the patient who have abductor dysphonia, the symptoms are aggravated. Like adductor spasm dysphonia, cause is not known. In this case, treatment is again botulinum toxin injection in posterior cricoarytenoid muscle by percutaneous route used with electromyography or endoscopic route. Results not as good as in adductor type. 50% of patients improve and duration of improvement is also less. Treatment disadvantages of toxin injections. Now there are some disadvantages also, and there is compromised vocal cord movements, airway obstruction. Other treatment options include thyroplasty, type 1, fat injection, gel foam injection, speech therapy combined with injection treatment. So again, along with some advantages of botulinum toxin, we have some disadvantages also, and these disadvantages include the compromised vocal cord movements. Airway obstruction can also occur. Some other treatment options are thyroplasty, fat injections, gel foam injection, and the speech therapy. Mixed dysphonia. Now, when both abductor and adductor muscles are affected, the more complex type of dysphonia is this. So that concluded our topic lecture section 4. Thank you for watching sqadia.com.